Our first speaker today is Dr. Charlie Staples. His topic today is going to be a story beyond fatty liver. Dr. Staples is Foundation Professor at the Department of Animal Science at the University of Florida, earned his animal science degree at New Mexico and Illinois, became a full professor in 1995. He teaches both undergraduate and graduate level courses. His research is primarily focused on the effects of dietary nutrients on production and reproductive performance of lactating dairy cows and improving forage utilization by dairy animals. Dr. Staples.
Yeah, thanks, Glenn. As Glenn said, thank you for staying around and sharing the next hour and a half or so with us. As Glenn said, I'm from the University of Florida, and whenever we talk about Florida animals and flora and fauna, the Florida gator comes up. And I don't know if you've seen this little video regarding the gator's interaction with some little bigger animal that kind of met his match. Usually the gator is the big bully on the block. In this case, he meets a mother who's trying to protect her young and kind of meets his match. So this is only about a 15-second video. Another thing about living in Florida, as you know, President Trump's got his weekend retreat down there at Mar-a-Lago, and he goes down there quite frequently. And he and Congress have been working on a shortened tax form for us, so they're kind of revamping the taxing system. And so being in Florida, they released kind of a prototype of what that's going to look like when we get it released maybe in 2018 for the 2017 taxes. Of course, we've already filed. Hopefully everybody's filed this year already. So this is the opening. Of course, it all looks very familiar. Here you have your name, your social security numbers, your address, and you can donate money to the presidential elections. And it's very short. In fact, just two boxes to fill out. One is, how much money did you make last year? You put that number in there, and then you send it in. So that completes the whole form there, and probably can get that in by January 2nd. Turning more to agriculture and dairy cows, the NRC has been around for 40 years, and Rich is going to talk to us more about that. And it's a very live document, and it gets updated every so often. And we, in nutrition research, know that area of nutrient requirements needs to be continually advanced. And as you look at some of the key nutrients that we know are essential for other species, have yet to be identified quantitatively for the lactating dairy cow. So for example, some essential long-chain fatty acids we know are essential for non-ruminants, and we believe they are for the ruminant as well, but we haven't quantified those. Florida, we've been working some on those. Amino acids, certainly methionine received a lot of attention. Histidine also is kind of on the horizon, trying to quantify the needs there. And a whole host of vitamins that have not yet been quantified for requirements are listed here. Florida there, we've worked some with vitamin E, and right now we're working in the area of choline feeding and metabolism. So we're still asking the cow to come into the office and take a look at her and see what we can do to better match her requirements with our diets. So today I'm going to be focusing on our work with choline as done with some studies at the University of Florida. So as you may know, choline is defined as a vitamin, or at least as a quasi-vitamin. It is an essential part of all mammalian cells. You can find choline in various forms in the body. Probably it's found most commonly in a compound called phosphatidylcholine. And phosphatidylcholine helps form a bilayer of lipids surrounding each mammalian cell that serves as a gatekeeper for letting other nutrients into the cell crosstalk, and it makes up around 50% of all the lipids in a cell membrane. Now, with other species, the deficiency of choline in diet often results in some very clear negative effects. So, for example, with rats, dogs, and people, we know that if we have a diet that's deficient in choline, that we're going to get fatty liver. In fact, kind of the key recipe for creating fatty liver in a rodent is you simply take choline out of the diet, add a little fat to the diet, and in 3 days you have fatty liver. In young chicks, choline is included in the diet in order to prevent slip tendon or porosis. In a series of, I think, 22 studies or trials involving over 500 sows, it was determined that choline helped reduce, or a deficiency of choline resulted in a reduced weaned piglets by 0.4 per sow. So we know it's necessary for the lactating sow as well. Regarding rats, lack of choline has reduced feed intake as well as weight gain by rat pups. The immune system of the lactating rat is impaired if she doesn't have enough choline. And lastly, regarding its role in memory function with rats and people, a lack of choline has shown that the mental acuity of those species are reduced. So we have a pretty nice list of benefits that occur in species if choline is in the diet in sufficient amounts. So an essential nutrient, what is that? An essential nutrient has to be in the diet because the animal can't synthesize enough of it to meet her requirements for that nutrient. What is the requirement? Back in, I think it's 1932, it was first identified as a nutrient for the dog. And 66 years later, we finally decided that the requirement for a pregnant mother should be 0.45 grams per day, because choline is transferred across the placenta into the newborn in massive amounts. In addition, once the baby is born and the mother is lactating, choline is a key component of milk, and so the requirement for her is up a bit, up to 0.55 grams per day. The swine industry has identified the lactating sow as needing about 3 grams per day of choline to support her young. And then lastly, the dairy cow, we don't know what the requirement of choline is for her, but she's a mother, she's lactating like these other species, and if you project the amounts here, it may be that she requires about 12 grams per day, but that's yet to be determined. Now, choline in the form of phosphatidylcholine shows a pattern around transition that makes one think that it may be in a deficient supply in that critical time of the cow's life. So if you plot phosphatidylcholine in the blood over that time period of 14 days before calving through 28 days after calving, you can see the concentration drops to about a third here at 0 and 7 days postpartum compared to what it is prepartum, and it takes about 4 weeks for the phosphatidylcholine to get back up into the concentration it was before she calved. Well, what is the relationship of phosphatidylcholine to fatty liver, which is a lot of work has been done with choline in the lactating cow and fatty liver. And some work recently with a group of, first author is Imhasley. They correlated or did a plotting of these 28 animals based upon their phosphatidylcholine concentration in the blood with the degree of fatty liver. And so there were 6 animals that had very high concentrations of phosphatidylcholine, and they showed no evidence of accumulation of fat in the liver. But as the phosphatidylcholine concentration was reduced in the bloodstream, the incidence or the presence of fat in the liver grew. So mild fatty liver when phosphatidylcholine dropped around 40, or so, and then it got lower and lower. The incidence of fatty liver went up. So linking choline, phosphatidylcholine, and fatty liver. So what is the connection between choline, phosphatidylcholine, and fatty liver? Just put this diagram. I've modified it some from Sean Donkin's work from 2011. So here we have the liver and a blood vessel there, and we have NEFA in the blood coming from adipose tissue and early lactation as the cow has a negative energy balance. So the NEFAs are picked up from the blood by the liver, and the fate of that NEFA can go several directions, about 4 different directions. One is it can simply be oxidized for energy and used to help increase the available energy for milk synthesis. Another option, there number 2, is that if the oxidation of the NEFAs for energy is incomplete, ketones are formed in the liver and they go back into the blood and they can be used by muscle and other tissues for energy. Third option is the NEFAs to be formed into triglycerides, and of course that's when we see the increase in fat and creation of fatty liver in our animals. But lastly, here's choline coming in if it's insufficient amounts in the form of phosphatidylcholine, and choline and the triglycerides can combine to form a compound called VLDL, very low density lipoproteins, which go into the bloodstream and can be taken to the mammary gland and used there for energy. So just a blow up of that very low density lipoprotein here with a phospholipid outer membrane, like we talked about earlier, and then inside that is the triglycerides. And this is thought to be the sticky wicket in getting fat out of the liver and into the bloodstream. And if that happens in less than desired amounts, we end up with accumulated fat in the liver. So when we look at the effect of feeding rumen-protected choline up here, protected from degradation, partially protected from degradation in the rumen, and that product is fed during the pre- and postpartum period, several studies have reported a reduction in fatty acids or triglycerides in the liver. All 3 of these studies reported those significant reductions in fat in the liver with the feeding of choline, which is the orange bars, and the controls are the blue bars. And a 4th study using feed-restricted pregnant dry cows to mimic a negative energy balance situation of the fresh cow, and they too reported reduced triglycerides in the liver compared to the controls when the cows were fed the choline product. So not all studies have reported reduced fat in the liver when the choline products have been fed, but there's a pretty good track record there. Another situation in which we see fatty liver developing, and that's where this study drew its hypothesis from, is that fatty liver often occurs in situations in which cows are overfed energy in the prepartum period. So in these 4 studies, mostly from Illinois, the dry cows, usually for the whole dry period, were fed excess energy, so they were consuming more calories than they needed for pregnancy and lactation, pregnancy and maintenance, or maintenance, in which the calorie intake was just about what they needed to meet the needs of the growing fetus and the cow's need. And when I looked at the fat content of the liver after calving, usually these within the first 2 weeks, 4 of these studies reported a significant reduction in fatty liver if the cows were fed to maintenance, and if they were fed to excess, the fat in the liver was elevated. So we asked the question then, if choline has a history of reducing fatty liver, might it be more effective in situations in which cows are overfed energy during that transition period or during the dry period? So this was our question we asked. Will supplementation with the ruminant-protected choline from Balchem during this transition period be more helpful to multiparous cows when they're fed extra energy during that non-lactating pregnant period? So the design of the study was to have those two type 2 levels of energy intake, prepartum, excess, and maintenance. And within each of those 2 energy diets, we had 2 amounts of feeding of choline chloride, either 0 grams per day in the blue box or 15 grams per day of choline chloride in the orange box, which is equivalent to 60 grams of ReaShure. So there we had 4 diets, 2 levels of maintenance, two levels of energy intake, and 2 amounts of intake of choline. And we fed the 2 energy diets ad libitum during the dry period, so we didn't feed restrict the cows at all. We fed those for an average of 48 days prepartum. And then the choline was fed starting at about the last 21 days prepartum through 21 days postpartum for about a 40-day feeding period of the protected choline product. Quick look at the diets. Those in the nutrition are interested in these. So I've got them up here. So here are the prepartum diets with excess and maintenance energy. You can see we used wheat straw, high-quality wheat straw that we bought from Ohio because we don't really grow much wheat straw in Florida. But you can see the concentration of wheat straw was only 8% in the excess energy diet, and most of the energy then was delivered in the form of corn silage. The maintenance energy diet was much higher in wheat straw, 37%. Corn silage reduced to 23%, and some triticale silage. We also had some wet brews, some citrus pulp, some canola meal, minerals, and biochlor in those diets. And then the lactation diet was really a corn silage-based diet with some of the typical ingredients. The chemical composition shown in this slide and a few of the next ones indicate the energy density of our close-up diets. So you can see that the excess energy was 0.74 megacalories per pound for that group, and it was only down to 0.63 for the maintenance energy group. And that was because of the higher NDF content when we were feeding all that wheat straw with the maintenance energy. 55 versus 43% there. The crude protein content would range between 13.5% and 14% for the 2 diets. The intake of metabolizable protein that were used with one of the computer software programs was around 1,000 grams per day. The methionine we tried to balance to what we thought was industry standard of around 2.3% of MP, both prepartum and during lactation. And we used DCADs in our close-up dry cow diets. They're not the same, but we were monitoring urine pH during that time to document that our cows were around that pH. The urine was around 6.0 in those 2 situations. We did have 93 multiparous cows participate in this study. And as I said, we fed them baled wheat straw. It was kept indoors, so to keep its high quality. We did chop it to 2 inches, and we fed it in a total mixed ration using wet brew in order to minimize the risk of sorting against the TMR, or I should say sorting against the wheat straw. We fed the cows in these Kaelin gate systems, and the students that were involved in this study were continually pushing that feed back up to the cows, because those of you who have fed high wheat straw diets know the cows tend to push it away and separate it out if they can. And so we kept intakes or weigh-backs really low and tried to make sure the cows ate the ration that we had formulated for them. And we measured the feed intake and the milk production through 15 weeks postpartum. So as we analyze the data for the choline and the Goldilocks diets, the Goldilocks being that maintenance type diet, the one that's just right, we didn't see any interactions between choline feeding and energy intake. Kind of like you'll see at restaurants where everybody's looking at their cell phones and not paying any attention or interacting with one another. My wife and I go back and forth on this sometimes. And speaking of cell phones, just those of you who still don't have Bluetooth in your cars, you can use that technique there to talk while you're driving hands-free. So what are the responses to the Goldilocks? How did the cows do? There was no difference between the excess energy and maintenance energy intake. About 1.3 pounds numerically greater when we fed the higher energy based diet, but the body weights were on 1,600 pounds, no different. The body condition scores were 3.5. Again, no difference starting out there for those two groups. And as we had planned, the energy status of the two groups of cows shown here the energy status was much higher for the cows that were fed the excess energy, the high corn silage diet, the green line, out here at 15 to 13 days before calving. They were about 140% of their energy requirement. Those that were fed the high straw diet, the yellow line, they were eating at about 110% of their energy requirement. The red line there is 100% of their energy requirement. And as the days drew closer to calving, you can see that the drop in energy intake really was different. There was an energy by day interaction indicating that they were on a high energy diet. Their drop in intake was about twice as fast as if compared to the cows that were on the lower energy diet. And several others have reported that this drop in intake prepartum, that the rate of that drop can have cascade or domino effects later on, and that the greater the decrease or the rate of decrease in intake in that prepartum period can result in some increased risk of some health challenges and disorders postpartum. So we had the cows set up like we wanted them to be, overconsumption of energy and meeting energy needs. So how did they do production-wise? Point out first of all that those cows that were fed the extra energy prepartum ended up producing 2.6 pounds per day less, consuming 2.6 pounds per day less feed, which was significant, and ended up producing 3.1 pounds per day less milk, but that was not significant at the 0.25 level. And with that difference in intake and feed, the cows, when we plot energy balance, in this pattern here, with the green being the excess energy and the yellow line being the maintenance type energy, that the cows that were overfed prepartum were in a more negative energy balance through the first 5 weeks, maybe even out here at 8 and 12 weeks tendency. They all came to positive energy balance around 8 weeks postpartum, but there's a negative balance deficit more for those cows that were overfed energy prepartum. So how did that influence the fat content in the liver? So we took 4 biopsies of the liver, one prior to calving, and then one at 1, 2, and 3 weeks post-calving. Again, the green line with the high energy diet resulted in cows that had higher liver triglycerides compared with those fed the high straw diet. So the mean across those 3 data points was 10.6 for the high corn silage diet, 8.5 for the high wheat straw diet, and that was significant. So the greater energy balance postpartum was accompanied by, as you might expect, more fat in the liver. So to summarize the Goldilocks results, compared with feeding to maintenance, the overfed cows, and they were overfed by 30 to 40% during the dry period, resulted in a lower intake of feed dry matter and a non-significant loss of milk of about 3.1 pounds per day. We detected and were treated, the cows were treated to a greater degree for clinical ketosis if they were overfed energy prepartum. 13% of the cows were clinically ketotic versus 0% for the cows that were fed to maintenance. As I said, there's greater liver fat in the first 21 days if they were overfed prepartum by about 2 percentage units. And lastly, the cows that were overfed prepartum took longer to start gaining body weight. It took them 14 weeks before they came out of that nadir of body weight and started gaining weight postpartum, whereas those that were fed to maintenance started gaining weight within 6 weeks. So certainly it looks like there's no advantage to feeding cows above their maintenance needs during that dry period. In this case, these are all fed during the complete dry period. And actually it shows that there may be some disadvantages to doing that. So let's shift, show you the data from feeding the rumen-protected choline. Again, there was no interactions between the two. Again, prepartum, the performance of the two animals wasn't any different in terms of feed intake, maybe a little over a pound a day numerically for those that were getting the rumen-protected choline, but it wasn't statistically significant. The body weights, again, about 1,600 pounds. Body condition score 3.5. As it turns out, those cows, even though they were put on the choline supplement 21 days before their calculated calving date, they only got the choline on average for 17 days prepartum. We didn't see any changes in blood concentrations prepartum, so I'm just going to show you the results of the cows postpartum. So here's the dry matter intake. The lines are on top of one another. In this case, the blue line is going to be those cows that did not get choline, and the orange line, those who are getting choline. They all started at about 2.25% of their body weight, and they peaked out here around 4% of their body weight, so they're eating quite well. The average intake across the 15 weeks in which we measured intake are listed here, about 51 pounds for the group not fed choline and 52.5 for those getting choline, but that difference was not significant. The milk yield did show a different response than intake. Again, this slide, this is where the RP-Choline here at the bottom was fed for these around this 6-week period. So the dotted line indicates up here where the animals did not receive choline any longer. But the response in milk of the cows that were getting choline was greater than those that were not getting choline, at least at the 9% level. So the milk production tended to be greater, and the average production over the 15 weeks for the two groups was 91 and about 96, or about 4.8 pounds or so more milk if they got choline in that transition period. We did follow the cows then through a 40-week time periods, so we stopped measuring feed intake here and the cows returned into the general herd, but we were able to follow their milk production for the rest of their lactation, at least through 40 weeks, and that response benefit of feeding choline in the first 15 weeks carried over to the rest of the 25 weeks after the trial stopped, and that the average milk response between the two groups listed here about 77 pounds versus 81, they're 0.8, so nearly 5 pounds more milk. So this transition out of the barns in another barn, that milk advantage they had earlier on carried with them when they went to a new location. So certainly the economics of having to pay for a vitamin or a feed additive like choline, in which you're feeding for 42 days, if you get a benefit of it beyond that feeding period through 15 weeks or even through 40 weeks, it makes it more economically attractive. So that benefit that we saw of 4.5 to 5 pounds kind of fits with what the rest of the literature shows with the feeding of rumen-protected choline. What I've plotted here is the 16 studies that are in the literature, in peer-reviewed journals, from back in 2003 up to 2016, and the orange bar just simply reflects the amount of milk that the cows gave if they were receiving rumen-protected choline. So you can see that the benefit was as great as 10 pounds per cow per day in this study, and in these last two studies it was actually less than the controls. The ones with the asterisks indicate those were significant improvements in milk yield, but 14 of the 16 showed numerical increases, and most of those positive ones were significant. Most of the rumen-protected choline fed in these studies was from the ReaShure, but they're not all. There was some rumen-protected choline fed as manufactured in Italy, France, China, so it's not all ReaShure. But this is situations in which the RP-Choline was fed in transition. That means it was started prepartum and continued into the postpartum period. So the average response across all 16 studies, including the ones here on the right on the end, are 4.4 pounds per day. So remarkably consistent. These are at least tendencies, so went up to 0.1 on those asterisks. So our study, what do we see in milk composition? We really didn't see any effect of choline on milk fat percent, about 3.8%, or on percent of true protein, close to 3% in both groups. We did detect an increase in production of milk fat and production of milk protein simply because we were seeing more production of milk. Those cows did not differ in the concentrations of NEFAs or in the concentrations of BHBA in their blood postpartum, regardless of feeding choline or not feeding choline. So where is the additional milk coming from? If we're seeing maybe a little bit more dry matter intake in our study, but not significant, a little more body weight mobilization. But I think one feasible explanation is where this milk is coming from is a change or maybe more efficient utilization of the NEFAs that are circulating in the blood in early lactation. So here's two scenarios where I've got one in which the choline is deficient. And if choline is deficient, we know that methionine can be used to donate methyl groups to synthesize choline. So they can also, methionine can also be used to synthesize carnitine. So carnitine is a carrier molecule that brings fatty acids into the mitochondria and allows the mitochondria to utilize that NEFA for energy. Now, in the case where choline is deficient, that growing big arrow there on choline, there's going to be a preferential synthesis of choline from methionine rather than methionine being made into carnitine. And so with that in mind, if carnitine is less priority, There's not going to be as much NEFAs brought in for oxidation, so there'll be less energy coming from fatty acids. There'll be more glucose oxidized for energy, and then as a result, reduced milk production. However, if choline situation is adequate, that means choline is being supplemented to the cows, the methionine doesn't have to be used to make choline. It can be used to make carnitine. As a result, we get an improved oxidation of the NEFAs for energy. Some glucose is spared, and we get improved milk production. We need to do some more work in this area to see if this is one of the ways that choline may be improving milk yield. So let's go on to look at a couple other things, at least in terms of health. And one is regarding the influence of choline on fatty liver. We saw some earlier studies reporting reductions in fatty liver with choline. You've seen these two graphs before. These are the energy balance and fatty liver situation in the Goldilocks study. So in those, just as a reminder, the cows that were overfed energy prepartum were in more negative energy balance, and the result, they had higher liver fat. So what I've got down here at the bottom left is energy balance for the choline and control group. And if you compare the two boxes or graphs, you'll see that the negative energy status of those two groups were also about the same spot, about minus 1112 megacalories per day as the Goldilocks group, and they were more negative in weeks 2 and 3 if they were getting fed choline. But if you look at the fatty liver situation, the addition of choline did not influence fat content in the liver. In fact, numerically is a bit higher here at weeks 2 and 3, but the p-value is 0.34. So even though the cows were in similar negative energy state here as we saw up with the Goldilocks study, we didn't see any change in fatty liver situation, which may suggest that the liver could be benefiting from choline in the diet and by improving VLDL synthesis and removing of fat from the liver so there's no accumulation. A couple other things health-wise that were new for us and for others, hasn't been shown in the literature previously, is the potential benefit of feeding ruminant-protected choline on some things like subclinical hypocalcemia. So these are the total calcium concentrations in the blood of cows on the choline or no choline treatments. We took blood samples at 0, 1, 3, and 7 days in milk. And the animals that were receiving choline, the orange line here, had higher calcium concentrations compared to those that were not getting choline, the blue line. And this was significant at about the 2% level. Dr. Hernandez earlier this morning did a nice job of talking about the potential downstream risks of cows with hypocalcemia and how the incidence in the cows in the U.S. can be between 30 and 50%. Well, when we used that 8 milligrams per 100 mils as our cutoff for saying whether a cow has subclinical hypocalcemia, and calculated the incidence, those that were without choline and the supplemental choline had a subclinical hypocalcemia incidence of 25%, and those that were getting choline reduced to about 10%. The influence of choline on body temperature was also interesting in that the body temperature taken at days 4, 7 and 12 days postpartum. It rose if the cow was on a control diet, the blue line. It went from about 101.6 to about 102. And if they were fed choline, they actually decreased in body temperature during that time frame. So at 12 days in milk, there's a difference in temperature of about 0.7, 0.8 degrees. So these weren't necessarily cows that had temperatures in the fever area, but show that the animal is getting back to a normal body temperature more quickly if choline was in the diet, again suggesting a potential role of choline in the immune system of the animal. So if there is a role of choline in the immune system, how might that be working? And again, we'll have to look to the non-ruminant literature to help us on that. TNF-alpha, or tumor necrosis factor alpha, is a key cytokine that is known in non-ruminants to reduce feed intake and insulin sensitivity and increase liver catabolism and inflammation. And with rats, with fish, with people, we know that choline, addition to the diet, can help prevent this accumulation of TNF-alpha in the bloodstream and therefore prevent these negative responses post-feeding. And certainly the work with people, this is the famous Atticus study in which they took healthy individuals. These are prisoners, I guess as healthy as you can be if you're in prison, but over 2,500 to 3,000 subjects, and they followed their choline intake, that those men and women who had greater intake of choline had lower concentrations of TNF-alpha and lower concentrations of another key cytokine, interleukin-6, that are pro-inflammatory, suggesting again that choline, just an association, that choline is going to, with greater intake, can reduce those pro-inflammatory cytokines that circulate in the bloodstream. And what did we find in our study at Florida? We saw the reduction in TNF-alpha in the bloodstream at days 3 and 14. Again, the orange line referring to choline is no change over time, whereas if the control cows, we followed them and their TNF-alpha went up. So it was the choline by day interaction there. And likewise, the other pro-inflammatory cytokine, interleukin-6, also was lower in choline-fed cows, again, suggesting that the animal was under less stress, having to deal with less stress, possibly because of choline's role in the animal's health. One other factor regarding the immune system is that these two cytokines I just spoke about, which are produced by the blood macrophages, which are some of the early responders to health challenges in the cow, those are picked up by the liver, and the liver then synthesizes an acute phase protein called fibrinogen. And if we have fibrinogen too high circulating in the bloodstream, it can have some negative influence on vascular function. And so we saw lower TNF-alpha and lower interleukin-6 in our cows, and sure enough, at least that first week, we saw lower concentrations of fibrinogen compared to the control animals. Okay. So moving from immunity, and let's look at reproduction quickly. We had 93 studies, so not a huge study, a huge number of cows to look at in terms of reproductive responses. Nevertheless, when we looked at pregnancy rate at the first insemination, around 77 days in milk, these are all timed AI system, that if we had choline fed during that transition period, the first service conception rate was 41%, which tended to be greater than the no choline group at around 24%. When we followed the pregnancy rate of the cows through 40 weeks, the numerical advantage was still there for the choline group, but it was no longer significant. This Cox proportion plot, when we're trying to determine days open, to see if there was a difference in days open between the two groups of cows. So here we have all cows open at 0 days in milk, and here's where they were bred. And since we got more cows conceiving there and pregnant with choline at the first insemination, the open cows had dropped down here, and that advantage kind of was maintained for most of the time period, but kind of they caught up together over here. So when we calculated the average days open It was 143 for the no choline and 20 days less for the choline group at 123, but it wasn't significant. They're at the 14% level. Now, why might choline help improve pregnancy rate? We know that choline reserves are depleted in lactation, at least early lactation for sure, through the fetus and into the milk. And some interesting work recently with choline in the human. This group here, when they administered supplemental choline to women, this increased the global methylation in the placenta, affecting the DNA. And so choline is a good candidate for modifying the embryo's development program to establish a pregnancy, to reduce pregnancy loss, and enhance the characteristics of the resultant offspring. So there's some work in the non-ruminant area that would be encouraging that we might see something in the cow, but we need more work done. I've simply here summarized what I could find in reporting of the effect of RP-Choline on pregnancy rate, these 5 studies, and the number of cows here, and the control and RP-Choline treatments here. So these first 2 reported higher pregnancy rates for the choline-fed group, only 62 and 40 cows in those 2 studies. This third study, numerically higher with 27 cows. The fourth one here, done in a field study in California with Jose Santos and Dr. Lima. Again, numerically better. A lot of cows in that study, 329, but they weren't significantly different in the pregnancy rate. Notice that all 4 of these first studies fed the RP-Choline starting in the prepartum period, but they fed a lot longer than what we typically see recommended or practiced in the field. They're feeding out to 80 days or 140 days in that second study. And that may be a possible reason why in that second farm that Jose and Dr. Lima performed with primiparous cows, 525 of them, they didn't see any numerical or statistical benefit to feeding RP-Choline in that one. They only fed the RP-Choline prepartum and stopped at the day of calving. Lastly, what is the benefit potentially of choline beyond milk and fatty liver? We were surprised to see some benefits here in colostrum, that the colostrum coming from cows that were fed the choline in transition was about 3 pounds more, but it wasn't statistically significant. But the IgG concentration was about 20 units or 20 grams per liter higher when the colostrum came from the choline-fed cows. And when you combine the 2 and multiply how many grams of IgG were produced by the choline-fed cows, they gave about 200 grams more IgG than the controls. Might that have an influence on the calves? Kind of in a retrospective look at the data from the calves born to those 93 cows, at least the heifers. We didn't do a complete job of, and we didn't intend to do this, to feed the calf born from a choline cow to receive that colostrum. So there was no attempt to control the source of colostrum for these calves born in this study. So these are essentially the exposure of the calf to choline in utero. So here at birth, the calves born from choline supplemented cows were a little bit lighter, about 5 pounds lighter. By weaning, they had caught up in body weight about 170 pounds. By the time they were 12 months old, they were about a 30-pound advantage. These are significant. And we don't yet have the data on their 24-month-old weights, but if that gain continues through the next 12 months, they would weigh around 60 pounds greater. So the average daily gain from weaning to yearlings was 1.87 for the no choline group and 1.97 for the choline-fed group, which was significant. So those calves benefited from being born from mothers fed choline and gaining more weight, at least during the first year. So why might calves benefit from choline supplementation to their moms? Again, we have to go back into the non-ruminant literature to maybe offer a suggestion for that. And this is work coming from gestating sows that were getting either 0 or 3 grams of betaine per kilogram of diet. And betaine is a choline metabolite. They sacrificed the piglets from these two groups of sows and analyzed their livers. They found that the piglets born from the sows that were fed the betaine had higher concentrations of glycogen, and they had greater expression of particular gluconeogenic enzymes that are necessary to make glucose at the liver, the PC, PEP, CK, and greater activity of that particular enzyme, suggesting that maybe the liver is improving its efficiency to make glucose, which in turn may benefit gain and explain the improved gain we saw in our dairy calves. We're kind of following that up with another study now at UF to see if we can document that. So 2 slides here summarizing the RP-Choline supplementation. They got 15 grams per day from 17 days prepartum through 21 days postpartum, so about 38 days on average. These are all multiparous cows. The key results here are greater yield of milk for about 4.8 pounds through both 15 and 40 weeks postpartum, regardless of the prepartum diet they were fed. Those animals also had greater negative, giving choline had greater negative energy balance at 2 to 3 weeks without increasing fat in the liver. The story beyond milk and fat in the liver is we saw greater concentration and yield of IgG in the colostrum, lower incidence of subclinical milk fever. This is if we used we had 25 and 10% when we had a cutoff of 8 milligrams per 100 mils of plasma. So this was if the cutoff was 8.5. I like the 8% or the 8 value as the better cutoff value for identifying subclinical hypocalcemia. Less inflammation in those animals with these reductions in key cytokines and acute phase proteins. Greater pregnancy at first service, there with those numbers. And better daily gains of the replacement heifers at least through 12 months of age. So Glenn, I'm going to stop there and give the people an opportunity to ask questions if they'd like to, if that's your preference. If Glenn's here. Clay? Okay. So the question was, how did we, or did we cool the prepartum cows? And they were housed in a sand-bedded outside area. We had shade cloth over the feeding area that were equipped with fans and sprinklers, and then they had shade out in the loafing area. So there was the heat abatement, but they weren't in free stalls. But all the animals, whether they got the energy, 2 energy diets or the choline, they're all treated the same. Any proposed mechanisms as to why feeding choline reduced subclinical hypocalcemia or elevated blood calcium? Yeah, I was talking with Dr. Hernandez today. I think we need to analyze the serotonin values in that blood. Another potential mechanism is osteopontin is a particular compound that's involved in bone matrix reformulation, and I think there's some evidence in the non-ruminant area that feeding animals fed choline, it changes the osteopontin activity, and that may need to be looked at also to see if that's what's resulting in our greater bone matrix mobilization and higher blood calcium.
Any other questions? If not, thank you, Charlie.